I'm Ian Paul. I'm a pediatrician. I'm professor of pediatrics at Penn State Hershey Children's Hospital. So there are many cases of unintentional overdoses of medication by children every year. About 70,000 children go to the emergency department every year. As a pediatrician, we'd like to see that reduced to try to make medication safer for children, try to prevent unintentional overdoses. I've been fortunate to be on the American Academy of Pediatrics Committee on Drugs for about 5 years, and as this was a drug-related policy statement or medication-related policy statement, I was in a position to write it. Policy statements are a guide or rules for pediatricians to follow to try to guide care, improve care, and set the standard of care for the treatment of children. This policy statement addressed numerous levels of the healthcare system, from the provider to the pharmacist to the manufacturer to the parent. And it addresses all different levels of that. So prescribers should be using milliliters exclusively when they write prescriptions or when they electronically prescribe them. We're encouraging manufacturers to only use milliliter-based dosing on their boxes, on their labels. We're encouraging pharmacists on their labels to only put milliliters for their dosing or metric units and eliminate any spoon-based dosing, and also administer a good dosing device like a syringe with metric markings to families. And then we want parents and caregivers to use only a syringe or a metric marked device and not use household spoons. Syringes are available at pretty much every pharmacy, and with most prescription medications, those syringes can be given to families with their prescription at no additional cost. Caregivers can often confuse teaspoons or tablespoons and their abbreviations, and in general, that's about a 3-fold difference. So the potential to overdose or underdose a medication certainly exists if the wrong spoon is given, and especially with repeated dosing, that could be dangerous to a child. The medicines that children are most often exposed to are fever and pain relievers like acetaminophen or ibuprofen, and cough and cold medicines and antihistamines. Those are the over-the-counter medications they have at home. And even those, if dosed improperly, can be dangerous. Prescription medications also are a source of error, but of course the most common medicines are those that I already mentioned, the over-the-counter ones, so they're going to be the most common source of overdose. If parents or caregivers are unsure about their dose or unsure how to administer the medicine or how to use the right device, they should ask their healthcare provider or their pharmacist for help.